Hi, this is Dr. Lindsay Remy. I'm here to talk to you a little bit about the week of your shoulder replacement surgery. At some point in the week or weeks ahead of your shoulder replacement, you will have a CT scan of your shoulder. I use this for what's called the VIP planning software, and that helps me precisely place the socket side of the shoulder replacement correctly. It also helps me understand your unique anatomy and plan ahead. Unfortunately, if you've had an MRI, this isn't good enough. I really need the CT scan, so this will be done. My nurse will also organize a preoperative visit. He or she will go over your medications, your allergies, your physical therapy plan after surgery, and all of those other details to make sure you're as safe and well prepared for this surgery as possible. One of the things that he or she will teach you is how to clean your skin to minimize your risk of surgical site infection. You will be provided with a chlorhexidine soap that you bathe with, but for shoulders specifically, one of the leading causes of infection is the same bacteria that causes acne in teenagers. It's called P. acne, and that can be treated ahead of time by using benzoyl peroxide, just like you see in the face aisle for teenagers with acne. You can buy that benzoyl peroxide soap and start bathing with it about a week ahead of surgery, and recommend you continue that during the time you also use the chlorhexidine soap that we provide, and afterwards when you resume showering, just to make sure that you don't have any of that acne bacteria on your skin. We use a third-party brace company called Kinex, and we typically recommend for shoulder surgery that you have an ice pack or polar pack machine that is not covered by insurance. You're not required to pay for that, but I do think it helps a lot with pain control after surgery, and so I encourage you to buy it if you are able to. You don't have to buy it through Kinex. We just arrange that for your convenience. Please know that you are welcome to borrow it from a friend or purchase it elsewhere if you prefer. You will also be ordered a special sling to keep your arm in after surgery. The amount of time that you're going to need that sling depends on the details of your surgery, but we'd like to make sure that you have a very comfortable sling option. The day before surgery, you will be called by the surgery center or hospital to tell you what time to arrive. On the morning of surgery, you will arrive between an hour and a half and 2 hours before your scheduled surgery time. Please know that I work very hard to make my surgery schedule as realistic as possible, but I can't always prevent some delays because each surgery is different in exactly how long it takes. Especially if you're a later in the day case, we may be running behind, so it might be helpful for you to bring a book or other reading material during that waiting time. While you're waiting, you're going to meet several important people. You're going to meet your anesthesiologist and the nurse anesthetist that will be helping care for you while you're asleep during the surgery. You'll also meet a variety of different nursing staff for the before surgery, the during surgery, and the after surgery part. Each of the members of my team are very important and will each help you through a different part of the day. Please talk to the anesthesiologist about any concerns that you have regarding anesthesia. Typically, the anesthesia for a shoulder replacement involves full general anesthesia with a breathing tube in order to protect your airway because I have you in an upright sitting position during surgery. You will also receive a nerve block called an interscalene block that numbs up your arm, and that's the best way to keep your pain control excellent from the very beginning. After surgery, you will be brought to the recovery area where you will slowly wake up, and we will make sure your pain is under control. We'll make sure you can eat and drink and walk comfortably before you're sent home. When you're sent home, the nurses will go over an instruction sheet from me that has all of the important information. Please check that for any of your questions or concerns first. That resource is very important. It has when your follow-up appointment is, when your physical therapy is, instructions on your incision care, and red flags to watch out for. You need to get dressed and put on your sling before you can go home too. And shoulder surgery is one of the surgeries where it is more difficult to get dressed again afterwards. So I recommend you bring a very loose button-up shirt so that you can slide it on around your arm and shoulder area. From recovery, your family will take you home and we'll start the journey towards full recovery. See you next time.